Hi, my name is Brian Bellinger. I'm a family nurse practitioner student at St. Joseph's College Online. And today I'm doing my voice thread for advanced pharmacology class. And I'm talking about Nexium. I watched a commercial about Nexium, which is esomeprazole magnesium, which is used for the treatment of gastroesophageal reflux disease, or GERD. The commercial starts by asks about exhibiting symptoms, if the patient is exhibiting symptoms of acid reflux disease, and then goes on to define what acid reflux is. They recommend talking to your doctor to see if Nexium is right for you, and talks about how Nexium can relieve symptoms as well as heal erosions in the esophagus that can be caused by acid reflux disease. They recommend talking to your doctor about the risk for osteoporosis, related bone fractures, and low magnesium levels with long-term use of Nexium. They also mention just a few side effects of headache, diarrhea, and abdominal pain, and remind you that other serious stomach conditions may still exist even though you are taking Nexium. The commercial is a pretty short commercial. It's only about 45 seconds long, so there's not a whole lot that they have time to go into as far as related to side effects and adverse reactions and like that. In contrast, the product insert for Nexium is 11 pages long when downloaded as a PDF. So there's a lot more in-depth regards to the symptoms such as low magnesium levels, and that it usually develops only after a long-term treatment such as a year of taking Nexium, whereas the average course of treatment that's recommended is only about 8 weeks. Talks about the risks of bone fractures related to the use of Nexium, as well as the mechanism behind that. Describes serious allergic reactions that may happen, and anaphylaxis that may occur with taking Nexium. It also, which the commercial didn't really talk about at all, it lists a very long list of medications that are contraindicated or may interact with Nexium. It also describes how to properly store Nexium as well as how to take it appropriately, and it describes the clinical pharmacology of Nexium. So when a patient comes in to ask about taking Nexium, I'm going to ask them why they think they need this medication. Is it something that it's new symptoms that have occurred that they haven't talked with me about previously, or is it a failure of a current treatment that we have? And I'm going to discuss other treatment options with them, perhaps some cheaper, maybe over-the-counter options, or other prescription options that I feel, based on the symptoms that they relate to me, may be better suited to their disease. Health information that I can provide to the patient. I'm going to talk about the contraindications. We'll need to go over the medications that they're currently taking to see if there are any medications that are going to adversely interact with Nexium. Talk about the possibility of fractures, osteoporosis-related fractures, and we'll also talk about the symptoms of hypomagnesemia, and how we may want to go ahead and get a baseline magnesium level before they start Nexium, just to make sure they're not already hypomagnesiemic. Common side effects: nausea, headache, abdominal pain. Also, that diarrhea is very common with Nexium, and that if it goes on for a long period of time, more than a few days, that I really want them to contact me so we can talk about perhaps some other treatment options. So my personal position on pharmaceutical ads is generally positive. I believe this can promote some very positive interactions with patients and allow patients to open up discussions that they may not otherwise feel comfortable in talking about. It's very advantageous to the patient because they can see that there are other people out there that have this same problem, or that there are treatment options available when they may have thought that it's something that can't be treated or that they just have to live with. So I think this can be very advantageous to the patient in allowing them to talk about something that they otherwise would be very reluctant to talk about with their prescriber. But I also want them to be sure that they understand that the information provided in these commercials, generally less than a minute long, is a very small amount of the information that's required to be able to prescribe and adequately understand the side effects of these medications, so that there's more information, perhaps some lab tests that need to be done, or certain diagnostic therapies, or even some other less serious or less invasive treatments that may need to be initiated prior to using some of these therapies or medications that they see about in the commercial.